How to perform competency testing. Initial competency is completed during the hospital orientation on their unit prior to performing a patient test by using the blood glucose monitoring skills checklist and performing a finger stick. Each associate is tested at the unit level for competency by using the blood glucose monitoring skills checklist at 6 months after hire and then annually. We want you to use standard precautions. Alright, to begin, we're going to turn the meter on. We want to then verify that the discard data on the control solutions is up to date. So if there's no data written or no date written, you want to discard the bottles. You want to follow policy, and we want to make sure that those bottles are labeled from 90 days from the day open. If you have the stickers, we prefer you would use the stickers. If you don't, a marker is fine, but we want that to be taped, whether it's the stickers or the marker, because the stickers will rub off easily, they'll fall off, and the markers will rub off. So be sure to put tape over your expiration dates. And remember, 90 days from the day you open those control solutions, or the manufacturer's expiration date, whichever comes first. Quality controls. The control solutions are tested on a daily basis to verify the performance of the point-of-care system. When opening a new bottle, write the discard date on the bottle label. Test solutions are good for 90 days after opening or until the expiration date printed on the label, whichever comes first. Invert the control solution bottle several times to ensure the mixing before using. Press the on-off button to turn on the monitor. Press number 2 to select control test. Press scan to scan the operator ID. Press scan to scan the low control solution. Press scan to test the test strip barcode. Remove the test strip from the packet and insert into the test strip port with contact bars facing up. Wipe nozzle with clean gauze or tissue. This prevents liquid left on the nozzle tip from a previous test that may have glucose concentration higher than expected. You'll then apply a small drop of solution to the test target area, allowing the target area to fill completely. Keep the monitor in a horizontal position. Do not allow control solution to drip into the monitor port. If the port protector becomes wet, replace it with a new one. Enter the appropriate comment code. And then remove test strip from the monitor, and discard. Press 1 to select the next level. Then you're going to perform the high control test by returning to step 8, which is press your scan to test the test strip barcode. And again, remove the test strip from the packet and insert into the test strip port with contact bars facing up. Wipe nozzle with clean gauze or tissue, and again, this prevents liquid left on the nozzle tip from a previous test that may have a glucose concentration higher than expected. Apply a small drip to the test strip target area, allowing the target area to fill completely. And again, we kept the monitor horizontal. Do not allow control solution to drip into the monitor port. If the port protector should become wet, we would like you to replace it, because if solution does drop down in there, it will interfere with the glucose monitor and possibly say error. But there we have pass. So we've done the high and the low controls. Now that'll be the end for the control test. For the competency testing, we're now at the patient testing portion. So for that, you want to select one, the patient test, and you need to scan the front of the operator ID badge. Next will come up 13 bolded dashes, and whether your ID badge has 6 digits, your ID number is a 6-digit ID or a 7-digit ID, you will put in a total of 13 digits. So if you have a 7-digit ID, you're going to have to enter 6 zeros. If you have a 6-digit ID, you've got to put in 7 zeros following your ID number. And then when you put the 13 digits in, you're going to press enter. And the machine is going to make you do it all again because we didn't scan. In our practices, we always want to scan. So again, you'll put in your 6-digit ID followed by 7 zeros, or you're going to put in your 7-digit ID followed by 6 zeros. And again, you'll hit enter. Once you get enter, it takes you to the strip icon, and now you're going to scan your glucose strip, your test strip from the package. Now remove the test strip from the package, again tearing it and not touching the outside portion of it. And you're going to go ahead and place it in the meter. And now we're going to use a control solution in this example. But if you are a new employee, this is when you are actually going to prick your own finger, and for this one time only you'll have to prick yourself. 6 months out and a year out, when you have to do these competency tests, you'll be allowed to use either a high or a low control solution. Fill the strip window completely with the control solution. Wait 20 seconds for the results. It counts down. When the results appear, the employee will follow the prompt and enter a comment code of 99 and then enter. You should see a 99 there in the top left box, a little box of 99. You'll also see your ID number followed by the zeros, and that'll give the date as well, and it'll clearly show then that you've completed the competency correctly. The most important thing now is to make sure you dock this so that you do get access and get credit and cross over to the Cerner lab system.
Performing a patient glucose test. Make sure you gather your equipment, wash your hands, and apply your gloves. Check the expiration date on the test strip. Turn on the glucometer by pressing the on-off button. Press 1 to select patient test. Press scan to scan your associate ID number on the front of your ID badge. Press scan to scan the financial barcode on the patient's armband. If the armband will not scan, obtain a new wristband, or in an emergency, enter the 13-digit FIN number. In an emergency situation such as a trauma, code blue, or birth of a newborn, and the financial number is not available, enter 9 13 times. Press scan to scan the test strip lot number from the package. Select sample type, either capillary or arterial finger stick, or venous, used only for venous samples. Before inserting the test strip, ensure that the port protector is installed and that it is clean and dry. Replace if necessary. Insert the test strip into the meter. Blue side up, black bars into the meter. An icon of a drop over the strip will display on the meter. Do not handle the test strip with wet or dirty hands. Do not use test strips after the expiration date. Do not reuse the test strips. Do not use test strip if the foil packet has a tear or puncture. Do not touch sample target area. Choose the puncture site and cleanse with alcohol, allowing the area to dry. Twist off the tip of the lancet device to remove cap, then holding the device firmly against the clean skin surface, lance the skin to obtain the blood sample. Wipe away the first drop of blood with gauze or a cotton ball. Gently squeeze the finger to obtain a drop of blood. Transfer blood to the white target area. Acceptable specimens include capillary blood from a finger stick, blood from the freshly drawn Vacutainer tubes, gray or green only, IV access prior to fluids being initiated, central lines when used for blood sampling, neonate heel stick. The result will display within 20 seconds on the screen. For adults, if the results are less than 50 or greater than 400, repeat the test. Enter the appropriate comment code. If results are the same, notify physician unless otherwise indicated. Dispose of the lancet device in the sharps container.
Okay, our glucose meters require 2 AA size batteries. Turn the meter off by pressing the on-off button of the keypad. There is an indicator on the top right corner. You'll get a message that will tell you the battery is low or that you have to change batteries. It won't go any further. So when that happens, you want to turn the meter over and open your battery door. You'll also have turned the meter off, but just open your battery door and there's your 2 batteries. And you just go get your 2 replacements and put them in and replace those. And then of course dispose of your batteries by your unit practice. They should have some safe method for disposing of the batteries in your unit. Align the battery compartment cover with the slots on the meter and then snap the cover in place. What we're going to go over right now is the proper maintenance and cleaning of the glucose meters with Mount Carmel. So what we have an example of here are the sandy wipes, particularly used at East, but you may find different ones at your hospital. They need to be alcohol or ammonia based for the cleaning. And it is so important that we make sure we wipe off each time in between patients, especially in those double occupancy rooms that we still have at some of the facilities. It's absolutely critical that you make sure you do wipe the machines off always and let them dry properly in between the patients. So the meter is definitely cleaned after each patient use, and be careful not to scratch the meter when you're cleaning. You also want to make sure the meter is turned off when you're cleaning it. We want to review here our docking station for the glucose meters. So the glucose meters need to be docked after any single use or after any batch of uses. And we want you to dock it at the minimum of every 2 hours. The meter must stay in the docking station until the upload is complete. There will be different messages that you'll see. You may see upload incomplete. If you see that message, you want to remove the meter and put it back down in. If the upload incomplete message continues though, you need to go ahead and take the meter out, mark it as what's the problem, and take it to the lab for replacement.
Comment codes do not need to be entered when doing the quality controls. They always need to be added when a patient test is being done. The numbers 1 through 10 are to be used when completing a test on an actual patient. Code 88 is used during training and 99 is used during the skills checkoff for competency. Comment codes allow the user to document events when a specific function is carried out on the meter. Comment codes are found in the glucose testing policy and on the case of the Abbott Exceed Pro. Misuse of equipment. Never use the glucometer for yourself, another employee, student or visitor, or family member. The POC glucometer is strictly for patient care. For questions, concerns, or a quick review, you can address the policy and procedure that provides step-by-step instructions on performing quality control testing or patient testing and troubleshooting the glucose machine. Always remember, you can contact your clinical educator for additional assistance.